Hey, good afternoon, everybody.
Definitely.
How are you?
Uh,
Doing great.
Well, thank you very much for joining us for this Zoom call. And let me just say thank you to all of you and to all of our frontline healthcare heroes for your incredible efforts and heroism throughout this entire pandemic. We're so proud of you and so thankful, and to everybody at the University of Maryland Medical Center and to each one of you. And this really is a pretty exciting day. That we still got some tough times ahead, but hopefully this really is the beginning of the end of this pandemic. And I'm just really proud of all of you and proud of UMMS and proud of all of our healthcare heroes. Maryland has really been playing a leading role at the forefront of developing COVID-19 vaccines and innovative therapeutics. And I know that researchers at the University of Maryland School of Medicine were the first in the US to begin testing Pfizer's vaccine. So I think it's very fitting today that all of you were among the very first to receive the vaccine. And so today and every day going forward from here, more and more Marylanders are going to have the opportunity to be vaccinated, and every single Marylander who wants one is going to be able to get one. But this is a phased process, obviously, and we're starting with all of you. Our highest risk, healthcare workers are out there on the front lines every single day. And I just want to say thank you for everything you do, but also thank you for being the first to get the vaccine, to show others how important it is, and that this is safe, and this is the way we're going to get out of this pandemic. So I'd love to hear from some of you about your experiences and what it was like today getting the vaccine, how that made you feel, but also just some of your thoughts about what you've had to go through during the pandemic, and how this is maybe a hopeful moment as we turn the corner and start to move forward.
I think that was a key word, hope. We've been on the front lines since March, caring for COVID patients. Sometimes being the last hand that a patient would hold, so hope, I think, is the appropriate word. And that was one of the reasons I definitely was more than welcoming of the vaccine. Coming from the background of being in the medicine field, I know that science works, and so I'm just happy that a vaccine has come, and we had the opportunity to be vaccinated.
Yeah, well, thank you very much. I know I see a number of people on here, people of color, and I know that's been a big concern in the Black community, particularly, that people don't feel that maybe because they don't have enough information, we haven't done a good job of convincing folks, but all of you can help us, I think, convince people that the vaccine is safe, that we are following the science, and that this is going to be critically important to saving, some vulnerable populations. So thank you very much for being among the first. You're the trailblazers. You're like the first ones landing on the moon, But yeah, hi, how are you?
Yeah, so I feel like we're the poster children, I guess, for this vaccine and its safety. I wanted to first thank you for your leadership in steering Maryland through this pandemic, because I feel like we've been ahead of the game relative to many states in our response to COVID, and I think it's from your leadership. So thank you for that.
Thank you very much.
I have to say, I'm not, I always take a vaccine, but I have to say, I don't think under different circumstances, I might have been the first in line for this, but this is, as you said, different. This is unprecedented, what we've gone through. And if we can all get vaccinated and begin to recover, because that's what we have to look forward to is, who would have thought, back in March that we would be in December still talking about this and still living this. And people dying the way they are. So, you know, again, as was already stated, the vaccine offers something to the return to normalcy, which I think is all we all want, although normal may look a little different when we actually see it.
Well, thank you. Thank you very much for the kind words. And by the way, I love the Ravens scrubs, and you know, I like you showing the colors on there. That's great.
We got to represent.
Yeah, absolutely. Well, thanks for everything you've been doing.
Yeah.
I would definitely like to second what Dr. Henry and Sean said, Governor, and thank you for your leadership. I wholeheartedly agree that your leadership and others has really positioned Maryland very well in confronting this pandemic and fighting it. And in terms of the emergency department, really, it's a privilege to represent emergency medicine and all of our emergency care providers who have been on those front lines since March, and having patients come into our emergency departments, some relatively asymptomatic, some mild to moderately symptomatic, and then some very sick patients that we've cared for really since the beginning of the pandemic. And it's an honor to stand among and represent my colleagues, you know, who have day in and day out showed up courageously. And we've had those anxieties about, do we get infected? What's the risk of bringing it home to our families? And then continuing to care for these patients throughout this pandemic. And I would say, you know, when I was asked to represent, you know, frontline providers, emergency medicine, and all of our emergency care providers, it was without hesitation in terms of thinking about the next steps in confronting this pandemic. And a few people have asked me, and I've said that we are starting to see the light at the end of the tunnel. Certainly many weeks ahead, many months ahead of continued high volume and continued critical illness secondary to COVID. But I think today we can feel confident that we've taken another step forward, and that light at the end of the tunnel is a bit brighter today.
Well, thank you, Doctor, and please pass on, you know, my deep appreciation to all of your colleagues in the emergency departments and everybody throughout the hospital system, but particularly some of you that, you know, you've been through some really difficult challenges, and I appreciate you kind of representing them today. But please thank them all, not just from me, but on behalf of all the people of Maryland. Appreciate them all.
Thank you. The team has remained strong, and I've been so impressed with how they've continued to support one another since March all the way through here. So I greatly appreciate that. We greatly appreciate your support.
Well, thank you very much.
I think that's important for the frontline staff to hear that we are recognized, you know, by the state and you as the governor for their hard work. I mean, the nurses on the front line, I oversee 3 of the biocontainment areas that care for the COVID patients, as well as the new modular care unit that we just opened on December 2nd. And so the nurses have, and all of the healthcare workers, from the housekeeping, physicians, everyone has been, again, doing a fabulous job. And so I think that this vaccination is going to be welcoming because we want to see this pandemic, you know, come to a close and, you know, to decrease at some point. And when you speak about people of color, that's one of the reasons that I wanted to definitely step up to the plate because I know there's been some hesitance. However, being African-American, we are 3 times more likely to be affected by COVID than any other ethnic group. And so there has been, you know, death and dying. However, I'm hopeful. My mother had COVID, my brother and my brother-in-law. It took my mother 2 months of being in the hospital to recover. Wow. However, prayerfully, she did with not, you know, many side effects from COVID. So I was more than welcome.
Wow. Well, thank you. First of all, God bless you. And I'm so happy that your family has been able to recover, and your mom was able to come out of going through a tough struggle like that. And thank you for stepping up. And please, as I said just a minute ago to Dr. Winters, I mean, please let the entire nursing staff and the rest of the staff know how much so I'm not just speaking for me, I'm telling you, I hear it every day from Marylanders, and maybe you don't always get a chance to hear everyone, but the people out there, they know how tough of a job you've all had, and they do appreciate it deeply, and we're all behind you.
Hi, Governor Hogan. It's a great pleasure to meet you. I agree with Sharon, Sean, and Mike. Everything they said is I 100% agree with. I am from the respiratory department, and I feel very honored to represent my department. Also to represent the Latino community as well. But most importantly, like I was so excited, but also emotional today. Unfortunately, my father passed away from the virus.
I'm so sorry, Daisy.
So I'm basically doing it in honor of him.
Well, I'm so sorry for your loss. So many people have lost, relatives, but to have you being out there on the respiratory therapists, we were talking about the emergency room and the nurses. I know you guys had a tremendous burden, and to have that personal, thing piled on top of that with losing your dad. I'm terribly sorry. My thoughts and prayers are with you and your family.
Thank you.
And thank you for everything you've done. And thank all the respiratory therapists. I know it's been an unbelievably difficult challenge for you, but please pass on my thoughts to your family and to your colleagues.
Thank you. And it was tough to get back to work. But now getting back and being able to be one of the first people to get vaccinated, I feel even stronger. And so I'm excited to see where this goes on.
Well, thank you, and thank you for representing the Latino community too, because we talked about earlier about the people of color. It isn't just in the African American community, but in our Latin American community as well, Latino community. We have some reluctance and people that don't feel safe. So helping us message this is going to save lives, so we don't lose more dads.
Thank you.
Now, I have to say, working in the trauma area, you don't think that we are going to be affected by COVID, but because it's pervasive in the community, we don't know which patients, when they arrive with injury, with gunshots, with whatever, whether they're going to have COVID or not.
Oh, yeah.
And that has been difficult because we really had to change our procedures and the way we approach patients. And, we had to take the time to protect yourself before you go in to see a critical patient. And that has been something that, was really difficult, I think, for a lot of us going in. We're used to just jumping in and,
Yeah.
and going for it. And we've really had to change how we do things. But again, I think, Daisy said it very well and Mike said it very well, that the staff, from everybody, from, the nurses, the techs, environmental services, the people who are there to everybody's there working for the common good of the patient. And it's really been really good to see. It's been very nice to see.
Well, Dr. Henry, I know you make a really good point about, I know you're professor of surgery and the director of the division of wound healing, and you're dealing with those patients already, the difficult trauma cases, the gunshots and the serious injuries, and that you're also dealing with protecting yourself from COVID and all of your folks. So, thank you for everything that you do every day, even when we're not dealing just with COVID.
Absolutely.
And all the other things that you do as well, you and your colleagues.
Absolutely.
We got one more, I think.
In terms of Sharon, I completely agree. Having to don and doff all of our PPE in and out of every patient experience, reevaluations, it's been challenging. Really, it has been difficult. And similar to folks coming in the trauma center, when they come into the ED, so many patients are undifferentiated and may, or may not have COVID. But I wholeheartedly 100% agree with what you just said, that at least in my 20 years here at the medical center, the team has always been strong, but I've never seen it stronger and more cohesive and working collaboratively together to really continue to get over the hurdle in COVID-19.
Well, this has been an incredibly challenging time for everyone for the past 9 months. And I've been so proud at the way that the people of our state have stepped up all around to help one another and help their neighbors, but particularly all of you involved in the healthcare space and at the University of Maryland Medical Center, all of our healthcare heroes. I mean, this is something I don't think anybody was prepared for. And it's just unbelievable, the effort and the caring and the risk you put yourselves in to help save everybody else in a time that was just absolutely critical to save lives and to keep people safe. And it's been incredible.
Well, thanks again for leading the way and leading us in the state, Governor Hogan.
Thank you very much. I think don't we have also Bill Thomas on? We haven't heard from Bill yet.
Yes.
Hey, Bill.
How you doing, Governor?
Good. Good. Hey, let me just thank you, because we talk about the doctors and the therapists and the nurses, but in environmental services, all of you come in so much contact with patients. And you're also frontline healthcare heroes, out there putting yourselves at risk and your families while you're trying to take care of and help everybody else in the hospital. So I want to thank you and your team also.
Thank you, Governor.
Yeah, thank you very much.
Right.
And thanks for stepping up and being one of the first to receive this vaccine. I'm really, this is an exciting moment for me as somebody that's been, begging for this vaccine for 9 months at least, to actually see it arrive at not only at the University of Maryland, but at hospitals all across the state and at nursing homes all across our state. We're still a long way to go. This is only the very first batch. And we're going to be ramping them up every day, continuously until everybody that wants a vaccine gets one. But you guys are the first. You really are. You're like Neil Armstrong. You're like first in space, the first to land on the moon. So we're proud of all of you very, very much. And we're proud of you today for stepping up to be on the front lines of the vaccine. But we're also really proud of you for being on the front lines every single day, and that you'll continue to do so. You and all of you represent a much larger group of people who not only work in your departments, in your hospital system, but in other healthcare providers all across the state and across the country and around the world. So I'm just really proud to take a few moments to be on with you and to get a chance to meet you and to just say thank you on behalf of everybody in our state.
Thank you. It was our pleasure.
Thank you guys very much.
Thank you.
Right.